When the COVID-19 pandemic struck in 2020, governments all over the world established various intervention projects to cushion the effect on citizens and scale up their economies. In Nigeria, the government carried out several projects through its COVID-19 Intervention Fund. These projects range from the distribution of palliatives, rehabilitation of primary healthcare centers, construction of isolation center to the rehabilitation and construction of road networks across the country. How effective were these projects carried out? With support from Innovation for Change Africa Hub, BudgIT embarked on a visit to two states, Ebonyi and Kano, to monitor the implementation of selected projects being funded by the government under the COVID-19 intervention projects. Our first stop was to track the isolation center at Achigu Health Center, Imyoha Development Center, Achigu Eza North Local Government Area, Ebonyi State. For the project, an unspecified amount was earmarked for its overhaul. However, upon our visit, we met the facility in a deplorable state.
And see the structure is very, very small. It cannot contain people that is coming in to treat. So that is why we then see our coordinator now give us that secretariat because we have enough space there. That is why we are managing that place. Then after quarantine them, then anyone that need to refer, we normally refer them to FETA because our general hospital here is not functioning as it's supposed to be. That is how we are managing them. We quarantine them. That development center, that is how we manage them, and we manage them very well.
Still, in Ebonyi, 200 million naira was approved for the general maintenance and repairs of Ubiago, Avuzo, Ogwo Road to enhance development and business opportunities in the area. Although the new road has been built, many locals are still concerned about its longevity because it was built without a drainage system.
We like the road. Kama. But there's no drainage and it makes it so spoil quick. We need government to come and help us to reconstruct the road. The road benefits us much than before now because formerly there's no poto-poto. Formerly there's poto-poto, but this time there's no poto-poto again. And it is motorable.
The conversion of Gwagwarawa Primary Healthcare in Nasarawa local government area to a cottage hospital was the reason for our trip to Kano. When we got there, we saw that the project has not even started. Gama's village head, Malam Rabihu Mohammed Ishako, says residents' health and safety are at risk because they must travel far to access adequate medical care.
When it comes to going to the general hospital, we either go to Murtala Mohammed or Abdullahi Wasai or Kuroda. So it's far away from the community. That is why we requested for this upgrade, because if it is upgraded, definitely our people will not travel far to seek for what they are. Yes, so many issues, because as I'm telling you, whenever we have serious issues pertaining emergency, we refer to either Murtala, that is, or Abdullahi Wasai or Kuroda. So it's very challenging because this hospital is very close to Gogoro police station, which they almost reported emergency issues like issues of accident. So we that is why we requested for this upgrading, because when it is upgraded, anything will be here. There is no more traveling to other big hospital in the city.
This clinic is nothing but to let the government, if possible, look at the higher number of clients that this clinic is receiving, to upgrade this clinic to a level higher than PHC, because now it's been upgraded, or more higher personnel that can handle complicated issues. Because with that, we are now referring complicated issues to higher facilities, and it's directly because of we are not to work beyond our limits. So if government can upgrade this clinic at the same time, we are sure that the services or the well-being of the catchment population people will be equally upgraded.
Rabiu Muhammad Ishaku continued by saying that the local officials have written to their representatives pleading for an upgrade of the primary health center, but to no avail. Infrastructure development is an important component of a well-functioning healthcare system, hence the need for these health facilities to be structured and equipped with utilities such as electricity, water, and an adequate workforce to meet healthcare needs and offer quality services.
Aisha Uba Ibrahim. Wallahi ina fama da ciwon kai ne, shine nazo na ga likita. Tsalolinka cikin yardar Ubangiji. Gaskiya muna roƙon gwamnati ta taimaka ta ƙara ɗaukaka mana daraja asibiti, a yi mana ɗakuna manya-manya musamman ma wajen haihuwa a asibitin nan. Muna buƙata a ƙara mana girman ɗakin haihuwa, a kuma ƙara mana ɗakuna na ganin feshafiya, duk muna buƙatar haka. Kuma muna so ɗakin operation ɗin ma da yake asibitin nan shi ma muna fatan a ƙara faɗaɗa shi, a ƙara girmama shi, tunda har operation suna yin operation na haihuwa, suna yin na ciwuka duk wanda ya samu. Saboda haka muna fata, muna roƙon gwamnati da ta taimaka a ƙara ɗaukaka daraja asibitin Gwagwarwa.
Gaskiya dai a ɓangaren marasa lafiya, inda ne zai yi gwamnati ta taimaka, ko kati ne ya koma fari. A dama already akwai magungunan da ake ɗan bayarwa a wasu lokuta fari, to wannan ya yi daidai, amma yana da kyau a ce kamar kati da mutane sun zo a ce fari suke karɓa ba sun saya.
You see, there is no a doctor that is a medical doctor that is stated in this facility as a permanent staff. You understand? It's only us, the nurses. Like I always know that we have midwife recently that the government employs some and then relocate them to this facility. So we are the one running the facility, and we made request. We went to advocate to the government that we need a medical doctor to send at least one standard doctor that will stay in this facility. Understand? Even if he can come twice in a week, at least he will reduce some of the problems. You understand? I want the government to look at the services. You know, place is growing. Before, the services are not like this, and now where almost all of the services we render them. It needs to be upgraded so that government, when the facility is upgraded, maybe government can now dedicate a doctor.
While the government has taken some actions to alight and allocate development projects as part of the COVID-19 intervention projects, it is also expected that it will put in place adequate monitoring, transparency, and accountability processes to guarantee effective implementation.